14% of SLO County is 65 and older. That number is slightly higher than the percent in both the nation and the state. Because of this, care for the elderly is a top priority. One aspect of senior health care is the controversial Measure D under Medicare.
Plan D is a new part of Medicare that helps people pay for their medications. But there seems to be a flaw in the system. It's known as the donut hole. The plan will cover 75% of their drugs up to $2,250. Then the donut hole is put into effect. At this point, they must pay 100% of their prescriptions until they spend $5,100. Then the plan kicks in again, and Medicare will pay for 95% of the costs. Though some people are confused and frustrated by the costs, some people are satisfied with their current medical care.
They've always come through very fast, very quickly, and never denied anything. I have wonderful doctors. They are very, very capable, competent doctors. I cannot complain.
Another San Luis Obispo senior is okay with her health care, but understands that the cost is high for some people.
Pretty good, I think, all around. And like I say myself, I had a good doctor, I had a few operations, and I had a good care, but a lot of people cannot afford it. So we can speak for ourselves, but a lot of people, they cannot afford it because they really are too expensive.
You're just able to help bring so much peace to people with just the information, because people will think that they're going crazy. And it's bereavement. We're just not prepared for how huge that affects us.
In that time of grieving, places like the Hospice of San Luis Obispo can help.
Mary Coons is the chief counselor at hospice.
And in our culture, people actually think death is optional. You'll hear things that say, those people have a higher risk of death, but they're not saying, today or something. It's like, I'm sorry, I think your risk of death is pretty much 100%.
Her and her colleagues feel that the simplest things can be done to help prepare for bereavement.
I think to get more prepared for this, I think education needs to start day one. There are lots and lots of cultures that begin to teach children about death when they can talk. They participate in the dying process. I think allowing children to go to memorial services, allowing them to be a part of the dying process and not be afraid of it, it makes it normal. This is a normal thing that we do.
I have a colleague who's from Guatemala, and I remember once asking her, are you going to the such and such event next week? And she said, if I'm here. And it definitely had a big tone to it. So it wasn't just, if I'm in San Luis Obispo. She meant, like, if I'm here on the planet. And apparently that's daily speech in Guatemala.
Hospice is now training people at businesses and churches in hospice care. Growing older and dealing with issues such as Medicare and hospice can be a difficult time in one's life. But there is help to guide seniors through these situations.